So when you think about those women that helped take care of you when you were little, that were there when you were hurt or afraid, what can you do for them? Imagine that we could create a different paradigm. So Women in Medicine is about bringing women into the workforce, helping them to advance and train in the healthcare workforce, lifting them up in leadership positions in the workforce.
We know right now 70% of the workforce in medicine is women, but yet they only have 25% of the senior leadership. So how do we balance that out a little bit?
Women in Medicine will do that in 4 ways. 1, we will continue to help provide these opportunities for intense mentorship. 2, we'll help invest in women's journeys towards advancing their education in medicine so that they can enter the workforce, advance in the workforce, and become leaders in the workforce. 3, we're going to help with the thought leadership and the development of the importance and the relevance of moving women into the workforce as a solution to the global problem. And finally, Women in Medicine will be conducting research about gender inequities, the barriers to women entering the workforce, and what some interventions are that could be the most effective. That will help not only them, but children. That will increase our provider density. That'll increase access to the services that children need. Large body of studies shows that the more gender equity there is in the workforce, the more health outcome equity there is in the population.
The main highlight of the research for me, which I think isn't a crazy novel finding, but is so incredible when you really take a moment to think about it, is the similarities. We had women on those programs from all over the world. It shows that women want to lead, but maybe don't seek those opportunities out as often, that they want mentorship, that they feel that their opportunities are growing, but they're still at a disadvantage. And it creates kind of a camaraderie of this universal experience being a woman in medicine, regardless of where you're from. The patient component was really important to us from a research perspective. Could this impact the mothers and the patients? And we saw incredible feedback on that, as the exposure of seeing women as their doctors, as their providers, changed their perception of what women can do.
Some of them who had baby girls or little girls said, like, this way I'm going to be able to tell my girl when she grows up that she can become a doctor, that she can be a psychologist, that she can be a nurse.
That's where Women in Medicine is right now, this powerful place of designing what are the most impactful programs and initiatives and interventions that we can design to help women become empowered and step into their power,